Hi, I'm Dr. Mihail Climov, and I will be answering today some frequently asked questions about tummy tucks. What is a tummy tuck? A tummy tuck is a procedure where we excise the skin from the lower abdomen, we plicate the muscle, and we transposition your umbilicus. It's a huge difference. Tummy tuck usually involves big incision, muscle plications, and transposition of your umbilicus. Liposuction involves using a special device to suction the fat through little small incisions around the body. The most common tummy tuck is a traditional tummy tuck. It involves an incision less than hip to hip and transposition of the umbilicus, plication of the muscle. Drainless tummy tuck or lipo-abdominoplasty. Another version is a mini tummy tuck. Mini tummy tuck does not involve plication usually, it's an excision of skin. Another version of tummy tuck is extended tummy tuck. Basically the excision is hip to hip, it's much wider. Then you can have a super extended tummy tuck where you go even beyond that. Another variation can be a circumferential tummy tuck, or it's also known as a lower body lift. And for massive weight loss patients, there are two additional versions of tummy tuck. The Fleur-de-lis tummy tuck basically has a component, a vertical component and a horizontal excision, or a corset tummy tuck or abdominoplasty, which basically it's an lateralized H incision, so two horizontal lines and one vertical. You can assess your excess of skin first of all, but ideally you just come for a consultation and the surgeon can guide you, provide the recommendation. As with any procedure, there are risks and complications. There are some general risks such as infection, seroma, hematoma, fluid collection, blood collection, issues with wound healing, scar. We are trading excess skin for a scar. Sometimes scar can be unsightful. The goal is to make it as nice as possible, as minimally visible as possible. Some pain, discomfort, asymmetries, but the big general risks for abdominoplasty is forming blood clots in the leg that can migrate towards your lungs, and there are things that we are doing to prevent that as well. It depends on the case. On average, I would say a tummy tuck would last from 3 hours to 4 hours. Recovery is about 6 to 8 weeks. As any surgical procedure that involves excision, it's a trade-off for excess skin for the scar. The results are permanent as long as the weight is stable. I say to all my patients, to get your final results takes about 6 months. Tummy tuck does not help. There is nothing actually that helps it with stretch marks. However, it can excise some portion of the skin that has those stretch marks. And actually, because we are stretching it, the stretch marks can look worse. A tummy tuck cannot help you lose weight, although we excise a small portion of the skin and we do liposuction, it's not significant to affect your weight. Many patients got pregnant after tummy tuck, ideally to time it before, because pregnancy can affect the result. You might need a little touch up after. It will improve your ability to exercise because usually tummy tucks are performed when there is separation of the muscle of the rectus, and when we tighten that, when we do the muscle plication, actually your core strength becomes stronger. So I had many patients that are actually experiencing more strength while doing sit-ups. So I think it puts anatomy back to where it should be. Absolutely. And that's usually what the mommy makeover is if you combine it with the breast. As with any aesthetic procedure, any shift, significant shift of weight, I would say over 10 pounds, depends on the body initial weight, would affect the results. You can see some lumpiness, unevenness, and some more visible asymmetries. Panniculectomy, it's excision of skin alone. Usually in people with significant skin excess, it is more medically necessary procedure. It does not involve muscle plication or transposition of the umbilicus. Diastasis is separation of the rectus muscle, of your six-pack muscle, and with all the tummy tuck, we perform this plication. So yes, we're fixing it with tummy tuck. Ideally up to 6 months, critically necessarily first 2 months. It is actually not as painful, and I'm using long-lasting injectable medications during the procedure, so it is very tolerable. It is uncomfortable, but with multimodal pain regimen plus the injection of long-lasting local, it is not a bad recovery. Absolutely. Ab-etching, it's a procedure, it's a liposuction variation procedure. Tummy tuck is excision of skin. However, we can combine, especially for men, fat grafting to the muscle while we're doing a tummy tuck, and that provides you some results that are mimicking etching. Etching means sculpting in the fat, emphasizing your anatomy of the muscle. But with fat graft, we're enhancing your actual muscle. So it's much more long-lasting and much more natural procedure. I hope I answered most of your questions about tummy tuck. I can't wait to see you in a consultation.